First suspected measles case in Billings. What you need to know. In a surprising turn of events in Billings, the first suspected case of measles has been linked to Cornerstone Community Church. During Sunday's service, Pastor Jeff Romans informed the congregation that a school-aged child, who had recently returned from a trip to an area with an ongoing measles outbreak, tested positive for the virus at a local healthcare facility on Friday. This child had participated in the church's Vacation Bible School, which attracted over 80 attendees, potentially exposing them all to the highly contagious disease. As a precautionary measure, everyone who came into contact with the child during the event is now adhering to the health department's strict 21-day quarantine guidelines. The child exhibited typical measles symptoms, including a high fever, runny nose, red and watery eyes, a distinctive rash, and spots inside the mouth. To confirm the diagnosis, medical professionals have sent samples, a throat swab and a blood sample, to the Montana State Laboratory for analysis. The Vacation Bible School took place from July 14th to 16th. This incident has raised concerns within the community and underscores the importance of vaccination and vigilance against infectious diseases. Measles, once largely eradicated in the U.S., has seen a resurgence in recent years due to decreased vaccination rates. And this is the part most people miss. While the immediate risk is to those who attended the Bible school, the broader community could also be at risk if the case is confirmed. This situation serves as a stark reminder of how quickly infectious diseases can spread in today's interconnected world. What are your thoughts on this situation? Do you think enough is being done to prevent the spread of measles? Share your views in the comments below. Measles outbreak hits summer camps. What parents need to know. Imagine sending your child off to summer camp, only to hear that they've been exposed to a highly contagious disease. Sounds like something out of a horror movie, doesn't it? But here's the reality. In 2025, this scenario has become all too real for many families across the nation. Summer camps, those cherished havens meant to pull kids away from their screens and immerse them in the wonders of nature, are now facing an unprecedented crisis. Between natural disasters wreaking havoc on campgrounds and a startling resurgence of measles outbreaks, parents are left grappling with fears they never anticipated. Let's start with the floods. In July 2025, devastating floods hit Camp Mystic in Texas, leaving widespread destruction in their wake. The incident not only raised serious questions about safety protocols but also forced countless families to reconsider whether sending their children to such locations is worth the risk. And just when you think things couldn't get worse, enter measles, a disease that was supposed to be under control thanks to decades of vaccination efforts. Yet, here we are, dealing with one of the worst outbreaks since the early 1990s. Measles, as most people know, is no joke. It spreads rapidly through coughs and sneezes, thriving in close quarters like dormitories or cabins where kids gather during camp sessions. For parents who diligently vaccinate their children, the thought of an outbreak might seem distant, even irrelevant. But this is the part most people miss. Herd immunity relies heavily on high vaccination rates. When those rates drop, as they have in some areas due to misinformation or personal beliefs, everyone becomes vulnerable. Even vaccinated individuals face increased risks. And this is where the conversation gets controversial. Should camps require proof of vaccinations before allowing kids to attend? On one hand, mandatory vaccination policies could protect entire communities from preventable diseases. On the other hand, opponents argue that such measures infringe upon personal freedoms. Where do we draw the line between public health and individual choice? These are thorny questions without easy answers. So what can parents do? First, stay informed. Understand the risks associated with any camp your child attends, including its location, emergency preparedness plans, and vaccination requirements, or lack thereof. Second, advocate for stronger health safeguards within these programs. If enough voices demand change, perhaps future summers will be safer for all children. What's your take? Do you believe camps should enforce strict vaccination rules, or does that overstep boundaries? Share your thoughts below. Let's keep the discussion going.